নমস্কার, দেখছেন TV9 বাংলা। আমি তন্নিষ্ঠা রয়েছি আপনাদের সঙ্গে। হেলথ প্লাস অনুষ্ঠানে আপনাদের সকলকে স্বাগত। দক্ষিণ ভারতের অন্যতম শীর্ষ মাল্টি সুপার স্পেশালিটি হাসপাতাল যশোদা হসপিটালস হায়দ্রাবাদ 1989 সাল থেকে আধুনিক চিকিৎসা প্রযুক্তি ও মানবিক যত্নের সমন্বয়ে কোটি কোটি মানুষের জীবনে এনে দিয়েছে নতুন আশা। সমাজিগুড়া, সেকেন্দ্রাবাদ, মালাকপেট ও হাইটেক সিটিতে 4টি অত্যাধুনিক ইউনিটে রয়েছে প্রায় 4000 বেড, যেখানে চিকিৎসায় নিয়োজিত বিশ্বমানের ডাক্তারদের দল। ক্যান্সার কেয়ার, কার্ডিয়াক, নিউরো, অর্থ, ট্রান্সপ্লান্ট সার্ভিসেসের সঙ্গে রয়েছে অত্যাধুনিক MR লিনাক ও রোবোটিক সার্জারির সুবিধাও। যশোদা হসপিটালস হায়দ্রাবাদ, আপনার সুস্থতার বিশ্বাস, আপনার জীবনের নতুন অধ্যায়। আজকের আলোচনার বিষয় হলো ভারত ও ভারতের বাইরে কার্ডিওলজি বিভাগের সাম্প্রতিক অগ্রগতি। আমাদের সঙ্গেই আছেন স্টুডিওতে ডক্টর ভরত পুরোহিত, সিনিয়র কার্ডিওলজিস্ট, যশোদা হসপিটালস হায়দ্রাবাদ, হাইটেক সিটি ও ডিরেক্টর অফ ক্যাথ ল্যাব। আপনাকে অনেক স্বাগত TV9 বাংলায়। আমি প্রথমেই আপনার থেকে যে বিষয়টা জানতে চাইবো যে হার্ট অ্যাটাক কি, কেন হয়?
হার্ট অ্যাটাক ইজ ডিফারেন্ট দেন ব্লকেজেস। আপনি জানিছে খুব সারে মানুষের ব্লকেজ থাকে, বাট ব্লকেজ ইজ নট সিনোনিমাস উইথ হার্ট অ্যাটাক। When somebody develops abnormal habits like he has diabetes, hypertension, high cholesterol, smoking, sedentary lifestyle, obesity, all these things make him prone to develop blockages. The cholesterol gets deposited in the blood supply, which is supplying the heart. But the good thing is, in our blood circulation, there is a protective layer which we call as endothelium. The cholesterol always gets deposited below it. Okay. And this endothelial layer actually protects it. So you may develop 20% block, 30%, 40%, 80% block, but still you have not got a heart attack. Even you can go up to 100% block also, but without heart attack. But in some people, this protective layer is very fragile and thin, especially in those who have got multiple risk factors like diabetes, hypertension, smoking, I told you. So this protective layer, if because of something it breaks, then the underlying material, whatever is there, it gets exposed to the flowing blood which is going through that. And blood has a tendency that the moment it comes in contact with anything foreign, immediately it will form a blood clot. You have seen it when we develop a cut, our blood clots immediately. So same thing happens in the blood supply also, coronary artery disease. The moment the blood clots, the flowing blood will stop and your heart muscle will not get blood supply instantly. And that is what we call as a heart attack. Okay. Because of blood clotting, sudden stoppage of blood supply to the heart muscle leads to damage of that muscle, and that causes a heart attack. Okay. And that is the reason why the heart attack is always so sudden. You will be absolutely fine and suddenly you will have a pain.
Okay. Sir, can you please explain what is heart failure, heart attack and cardiac arrest?
It's a good question. Lot of people, they mix all these things. Heart attack, I already told you, the blood clots inside the blood supply to the heart, and it gives rise to damage of the heart muscle. We call it as a heart attack. Heart failure is when, because of any reason, whether it is heart attack or whether it is a valve disease or whether it is irregular heart beating or whether it is due to some infection which causes weakness in the heart muscle. So the heart muscle is not able to perform its work. The work of heart muscle is basically to pump the blood to the body. And if it becomes weak, we call it as a heart failure, LV dysfunction, and which is called as a heart failure. Okay. Cardiac arrest means the heart stops working completely. And it may be due to any reason. It may be due to heart attack, it may be due to weak heart muscle, it may be due to accident, it may be due to severe infection in the body, it may be due to blood loss, anything which causes some changes in our body which leads to stoppage of the heart, we call it as a cardiac. It may be due to brain stroke also. So cardiac arrest is the final thing when the patient dies, which could be due to anything. Heart attack is one of the reasons for cardiac arrest. So we should understand these things. Heart attack is basically blood clotting, giving rise to sudden stoppage of the heart blood supply to the heart muscle and damage. Heart weakness leads to heart failure. And finally, when the heart stops beating, we call it as cardiac arrest.
স্যার আমার আপনার থেকে জানতে ইচ্ছে করছে যে এখন ইয়াং জেনারেশনের মধ্যে অনেকের ক্ষেত্রেই দেখা যায় যে হার্ট ফেল বা কার্ডিয়াক অ্যারেস্ট এটা বাড়ছে। আমরা যদি রিসেন্ট কিছু পাস্ট এক্সাম্পলস দেখি তাহলে অনেক অ্যাক্টার্সদের ক্ষেত্রেও দেখা যায়, যারা জিম করে তাদের ক্ষেত্রেও দেখা যায় অনেক সময় হার্ট অ্যাটাক হচ্ছে। এটার কারণটা কি?
See, as I told you, any reason which gives rise to breakage in the endothelial layer gives rise to formation of blood clot, and that gives rise to heart attack. When we do gym activity, we are controlling one risk factor, that is activity. But these gentlemen may be having other multiple risk factor, like extreme stress level, like diabetes, high blood pressure, smoking history. So just because one is doing an exercise, that doesn't mean he can counter all the other risk factors. So this gentleman might have already developed some level of cholesterol deposit, and because of his smoking and other risk factor, this endothelial layer must be weak, and when he was doing extreme activity, extreme gym activity, probably that fragile endothelial level broke and he developed a blood clot inside that blood pipe, which we call as coronary artery disease, and that led to a heart attack. So just because somebody is doing a gym activity or regular exercises, that doesn't mean it counters all the other risk factors which are there, including unhealthy eating habit also.
বাট ইয়াং জেনারেশনের মধ্যে আজকাল হার্ট অ্যাটাকের সম্ভাবনা বা চান্সেসটা কেন বেশি?
That is mainly because nowadays, if you see the young generation, their lifestyle is completely haphazard and very, very unhealthy. They don't sleep at time.
And stressful
they,
also, I think.
They take extreme level of stress. Their physical activity is very, very negligible, almost zero physical activity. Their eating habits are completely wayward. They tend to smoke a lot, drink a lot. So all these factors which have come up, and which many times I have seen young people, they feel proud about all this unhealthy activity. So all this has led to development. And one of the most important thing is, as a parent also, we have many times encouraged that, like when a small child is there, instead of telling him to go and play outside, because of our busy schedule, we give them a mobile or a tab, and they get hooked into the virtual world.
Right.
So all this leads to sedentary activity and childhood obesity, and that leads to a future blockages and a heart attack in this. So that's the reason why suddenly we are seeing a huge surge of heart-related issues in young people.
ওকে, বাট হাউ টু আইডেন্টিফাই, মানে আমি কি করে বুঝবো যে আমার রিস্ক ফ্যাক্টরসগুলো রয়েছে, এবারে সামনেই আমার হার্ট ব্লকেজের কিছু সিমটমস কি রয়েছে, আগে থেকে বোঝা কি যায় যে আমার এটা হতে পারে, হার্ট অ্যাটাক বা কার্ডিয়াক অ্যারেস্ট আমার হতে পারে?
See, basically, every individual in current scenario is at a risk of developing blockages, because you can understand the way we are living in the current society. We are always at risk of something. The air pollution is there, the food pollution is there, the stress levels are there. So we are all at risk. So the most important thing is identify all the risk factor and make necessary changes. So how do we identify whether I am at a risk of getting a blockages or a heart attack is, first identify your risk factor, what they are with you. Are you active or not? Are you doing regular exercise or not? Whether you are eating time to time healthy food or not? Are you more eating the junk food and the fried items and fast foods or not? What level of stress control mechanism am I doing? Am I doing regular yoga, meditation, pranayam, reiki, all these things or not? Am I playing physical, that means physical activity I am doing outside or not? And what is my work schedule? Am I maintaining a good work home balance? I am life work, or what you can say is work and the home balance, whether I am maintaining it or not. And I should know my numbers, whether I am having high blood pressure, my sugars are all right or not, my cholesterol levels are all right or not. So when you have this comprehensive analysis, nowadays with the AI, you can always put all this risk factor and they can give you a score. What is your predictability? What is your predictable score for future development of blockages or not? So there are definite scores available by which you can predict what is your 10-year chances of getting a blockages or a heart attack or not, and accordingly you modify yourself and become more healthy.
স্যার, ইফ মাই হেলথ চেক আপ ইজ নর্মাল, তাহলে কি আমরা এই রিস্কটা থেকে বাইরে থাকবো যে আমাদের হার্ট ব্লকেজেস হবে না?
Yeah, that's a very common question, because a lot of people come for regular health checkups and then they say ki I have done my ECG, my 2D echo, my TMT, everything is normal. See, basically when we do health checkup, we are only trying to identify the risk factor, but there are certain risk factors which are underlying level which these health checkups cannot tell you. One is stress. By doing a regular health checkup, you cannot tell whether you are under stress or not. These health checkup, they do not tell you what is the time at which you are sleeping and when are you getting up. These health checkups, they do not tell you about your genetic predisposition. If somebody's father and mother had developed heart-related issues early in the childhood, early in the age, like below 55 in the male and below 65 in female, they are at a high risk of getting a blockage. So health checkup only takes care of certain part. So just because somebody's health checkup is normal, that doesn't mean he will not get it. He can still get it, but those probabilities will be less.
In order to diagnose blockages, মানে কোন মেথডটা বেশি ইম্পর্টেন্ট বা বেশি ভ্যালুয়েবল বলা যেতে পারে?
See, basically, when a normal individual comes to our hospital, the most basic test which we do are the ECG, 2D echo and a treadmill test. ECG echo may still be normal, but if you have a blockage, a treadmill can identify whether somebody has got a blockages which are more than 70% or not. Even TMT or stress test also will not identify blockages less than 70%. So if somebody is very, very strict that I definitely want to know whether I have a blockage or not, then in them we suggest them to go for a CT angiography. And if the probability, after looking at everything, if as a doctor feels that his chances of getting blockages are very high, then we recommend them to go for a conventional angiography. So these are the two methods by which with maximum predictability and maximum sensitivity and specificity, you can tell whether he has a blockage or not, CT angiography or a conventional angiography.